Good morning, ladies and gentlemen. Feels absolutely great to be back to the RAADFest. I believe same as everyone here. Those whom I've seen before for the years, in the past years, getting younger and younger. That means that it's really working, the event is really working. And I'm Dr. Dmytro Klokol. I'm head of the Medical Advisory Board for the European Wellness Biomedical Group. We are an international organization, a chain of research and development facilities located in Europe and in Asia, and also clinical facilities, which we still have traditionally in Europe, in Germany, in Switzerland, Lugano, and our latest acquirement is in Greece. And the rest of our clinical facilities, which provide regenerative medicine, anti-aging, and longevity medicine services all over Asia in many countries. That's where I'm for almost 17 years, past 17 years, living and working and practicing in Asia, mostly in Malaysia. European Wellness Biomedical, mostly involved in biological medicine. We develop new treatment modalities in longevity, regenerative medicine, anti-aging, including we work on the stem cells, we work mostly on the research and development of the organ-specific progenitor, the precursor stem cells, peptides, growth factors, Thymus therapy, immunotherapies. And today I'm going to talk about Thymus therapy and call it a dark horse of anti-aging because immune system is something a bit non-tangible, and Thymus therapy is one by far the most underrated and unappreciated therapeutic modality of regenerative medicine that actually, if used properly and timely, it yields fantastic benefits for the longevity and health, not just to increase the lifespan, but increase the health span. Last year, we have published a very nice, interesting book called Immunotherapy in Bioregenerative Medicine, where we try to cover all aspects of immunosenescence and regeneration of immune system with biological medicine. This year, Dr. Mike Chan has published with the help of few other authors, including me, another book which is a deep dive into the Thymus therapy, which is called Thymus Therapy, the Past, Present, and Future. Some of the topics, some of the details that I'm going to talk about today are mentioned in those books, and if you want to know way more than you hear today, you need to read those books. I have the epigraph for this topic from esoteric writer Brian Grattan, which says, Thymus gland really is a seat of rejuvenating power in the body and enables the body to maintain its immortality. Well, we do understand that immortality is impossible, but in a way, these words, they do have a meaning. What do we know about Thymus? The ancient Greeks knew about Thymus. Actually, Thymus is a Greek word. Thumos means anger, but it also means heart, passion, desire, and biblical meaning of this word means the outburst of passion. So it was related to immunity and also emotions since thousands of years ago. Ayurvedic medicine, by the way, Ayurveda understands immunity quite well. They have a name for that, bala, which is an ability of the body to prevent, arrest progression of the disease and maintenance of the homeostasis. So ancient Indians, when they developed the Ayurvedic medicine, they have assigned a specific chakra, like a center in the body, energetic center for Thymus, and they call it the karmic chakra. In Sanskrit, Anahata, that's how they call it. Traditional Chinese medicine does not have the meridian, so they don't really identify this as a separate single organ, but they relate it to the spleen, which is another organ closely related to immunity. In Taoism, the Anahata chakra, the Thymus, it corresponds to the middle dantian. It's one of the energy points which is believed is the seat for the energy, ki or chi, which is the life, the energy of life. So if we look at the modern science, although Traditional medical systems perhaps knew it for thousands of years. Conventional medicine started researching thymus in the middle of the 19th century. Arthur Hassall, when he looked at the organ and he has identified clusters of cells inside it, and he thought that, well, maybe these clusters of cells are actually performing the function of this organ. And indeed, these clusters of cells now we call the Hassall bodies or the Hassall corpuscles. Now, of course, we know that it's a site that is responsible for the maturation of the dendritic cells, which belong to the innate immunity, and also the maturation of the T cells, the T lymphocytes, and over-activation of these Hassall bodies. They're responsible and play a very important role in development of allergies. And then for another 100 of years, there was a pause in the research of the thymus until Jacques Miller, who is a French-Australian scientist, in the 1960s, he gave a proper description of a morphology of this organ and the cytology, and explained this organ from the point of view of the modern conventional medicine. And yet that was not enough to understand the actual value and importance of thymus until 1980s. In 1985, Steinman has defined the morphology of the human thymus, and he most importantly has explained and described the mechanism how thymic gland is undergoing involution. It's degrading, degenerating. It's been replaced with a fat tissue and the fibrotic tissue starting from the first year of life. And now we know that thymus is a gland, it's a glandular organ, which is located just behind the sternum. It has two lobes, it has a capsule, it has inside two parts of it, the cortical side outside and the medulla inside. And cortex, the cortical part, and the medulla inside, mostly represented by very specialized thymic epithelial cells. We call them TES, true thymic epithelial space. And those thymic cells, they obtain naive, immature immune cells which are produced in the bone marrow. So when you do the full blood count, say in the age of 60 or 70 years old, and you look at the full blood count and you think that it's normal, it doesn't mean that you have a good immunity, because you basically count the immature lymphocytes. The lymphocytes that have left bone marrow, they are lymphocytes. They look morphologically under the microscope exactly like a normal lymphocyte. But until a lymphocyte or any other immune cell enters thymus, and thymus is a primary lymphoid organ, and migrate through the thymus from the cortex to the medulla, and after that is expressed from the thymus, that cell acquires actual immunological properties. That cell is a young, matured immune cells. And that's the importance of thymus. It's the preparation, maturation, priming of the immune cells. And what is happening in a different speed, you know, we have decline after 1 year old, then it starts declining after the 16th year of life, and then later in 50s and 60s. And what is declining? Both the cortex and the medulla. They're shrinking, they're reducing in its size, and they've been replaced with a fibrotic tissue and with a fat tissue. The rate of involution it varies at different stages of life, but it can be 1% to 3% and even as fast as 10%. So what we have that people who are 50 years and above generally have less than 10% of the actual functional thymus. And the rest, 90% or more, can be up to 95%, completely replaced with a fibrotic tissue and fat tissue which does not perform function. That's a bad news. Every bad news has got two good news. The first good news is that it is possible to regenerate thymus. And the second good news is that the science, we know how it's done. And that's what we're going to talk about in the rest of the 14 minutes that I have. Now, before we go towards the thymus regeneration, we need to understand that, first of all, no matter what you do, no matter how you live, you have an absolutely healthy lifestyle. You don't smoke, you don't drink, you exercise, and you drink holy water, but still your thymus is regenerating in spite of all your efforts, degenerating no matter how healthy your lifestyle is. When you use medications, when you undergo chemotherapy, radiotherapy, when you're exposed to the electromagnetic fields, when you're exposed to immunization, infections, those are additional contributes to fasten, to make it even faster, the thymic degeneration, okay? How dangerous it is? Well, it's very dangerous because thymic malfunction and thymic degeneration is the direct cause of the immunosenescence, the aging of the immune system. You all see how your skin, which is the largest organ in your body, ages because you use mirror, you touch yourself, you look in the mirror, you see wrinkles, you see the pigmentation, you're not happy. You don't see, you can assess you can feel your pulse, you can do ECG, you can have the idea of your cardiac function any minute you want, but you cannot have that idea about your immune system. It's something very non-tangible because you need to do a very special test which is called immunogram. So if you do the immunogram, you will be horrified. You will see that all immune cells, whether it's a T cell, NK cell, dendritic cells, macrophages, monocytes, all of those cells are degrading and deteriorating with age. We have less of the young, naive, functional cells. That ratio is reducing, but the amount of the old memory cells is increasing. That's a problem, and it's a direct cause of overproduction of the pro-inflammatory cytokines, and then further metabolic changes that also participate and worsen the metabolic syndrome. Immunosenescence directly causing inflammation, so it's a chronic low-grade systemic inflammation that is a hallmark of absolutely each and every disease of accumulation. Every age-related condition is associated with inflammation. And we have this inflammation because our immune cells, old, tired, memory cells, produce huge amount of pro-inflammatory cytokines. So, as far as our adaptive immune system concerned, impaired cell proliferation, impaired autophagy, mitochondrial dysfunction, and DNA damage is happening in our immune cells. And that cause and also contributes to, through the inflammation, to the worsening of other disease of accumulation, whether it's a cardiovascular, diabetes, cancer, psychological problems, depression, and so on and so forth, causing cognitive decline and frailty, sarcopenia, poor quality of life. Interestingly, that thymus is very pleiotropic. It means that it has effects on other organs and systems. For instance, thymic dysfunction is also causing the autoimmunity towards the islet cells of the pancreas. It's adding on to the pancreatic inflammation, and it's worsening contributing to the diabetic progression. So how to regenerate it? Thymic regeneration, it stands on the 3 pillars. It's a use of the thymic precursor stem cells. 1, thymic peptides, natural occurring molecules. 2, and through the growth hormone IGF ghrelin axis. 3. Number 1, and this particular pathway of thymic regeneration through the thymic specialized stem cells. And it's very important to understand here that it's not through the MSCs, not through the umbilical cord blood. It is only through the thymic progenitor or the precursor cells. We use the FCTI laboratory in our practice of European wellness. They've been for over 3 decades on the market, and this is the laboratory that is producing practically all types of the progenitor precursor cells that we need. So the thymic epithelial progenitor cells, they will further subdifferentiate into the cortical committed progenitors and the medullary progenitors, and they will enhance the regeneration of the thymic tissue at one side, but also they will directly stimulate the maturation of all the immune cells inside the thymus. That's first pathway. Second pathway, through the thymic peptides. These are naturally occurring molecules that are present in thymus. And the way how we procure them, the way how we get them, is by culturing the thymic progenitor stem cells in the laboratory in huge quantities and procuring the active ingredient, the peptides from them. So these peptides act as a biologic response modifiers. They regulate immune responses, but also they possess pleiotropic properties. What it means, they interfere with other endocrine organs, and they also have the effect on the central nervous system. We're going to talk about it in a minute. So thymic regeneration can be achieved. This particular slide, before and after, on the left slide, you see the outline of the thymus gland here and here. You see it's lighter here. It's a fat tissue. Fat tissue on the MRI will look lighter. When it's darker like this, higher density, it means it's been regenerated. It's been less than a year between slide left and right. And they've seen that by using the thymic peptides and thymic progenitor stem cells, this is part of the TREAM trial, has been published 2019. They been managed to increase the thymic epithelial space by 120%, more than double it. But interestingly, that when they run a number of other tests, those were the secondary objectives. So the overwhelming results show that the secondary objectives have improved tremendously. First of all, safety was absolutely undeniable because the main function of the liver and all, it did not change absolutely. There was a reduction of the PSA level seen in these patients. All of these, I mean those who were the male patients, all of them were 50 years and above. There was a reduction of the CRP, the C-reactive protein, okay? It's a reduction of the chronic low-grade inflammation. There has been a reduction of the interleukin-6, and there's been reduction in the insulin level and beta-glycemic control, and absolutely unexpected improved glomerular filtration rate. This was nobody could even expect, and nobody can explain why, but even the renal function is improved, has improved. And when they've done the Horvath methylation test, the epigenetic test, they've seen that from 9 to 12 months of thymic therapy, and the actual biological age reduction was up to 6 to 8 years within 9 to 12 months. So it's proven epigenetic aging reversal and reduction of the immunosenescence. As I said, it's a TREAM trial. TREAM stands for the thymus regeneration, immunorestoration, and insulin mitigation, with only one therapeutic modality, which is targeting thymic regeneration. Okay, so many benefits. Well, who else can benefit from that? It turns out that cancer patients benefit tremendously. Cochrane collaboration has published 3 reports in the past decade on 27 clinical trials. They've studied the overall survival, disease-free survival rates, and tumor response rates. They've seen that patients who are undergoing concurrent chemoradiotherapy for cancer and thymus therapy have 50% reduction of septic complications and 30% increase of the efficacy of anti-cancer treatment. They've also seen that addition of the thymus peptides to the treatment increased the disease-free survival rate by 20%. And products were absolutely greatly tolerated. On our side, we send our products to the Heidelberg University, where they've done the gene ontology study. They've analyzed the content, and they showed the strong presence of the antioxidant, anti-apoptotic activity in the peptides. They've done in vitro and in vivo studies. They have seen the increase of the phagocytic activity in human monocytes, accelerated differentiation of human T cells, reduction of markers of cellular aging in the colony of the human cells, and these thymic products has exhibited zero cytotoxic effect on the human stem cell culture. In vivo study has shown the increase of the production of the T cells by the bone marrow and increased maturation and specialization, the output of the functional naive young thymocytes, immune cells from the thymus. We have also, and this data has been published, it's been published last year. We have tested it on a number of conditions. You can see the conditions that they were used and some of the statistics. If you summarized in patients with primary, secondary immunodeficiency, patients with autoimmune conditions such as SLE, rheumatoid arthritis, patients with dermatological disorders, psoriasis, eczema, and patients undergoing chemo and radiotherapy, overall improvements calculated, the overall improvement was 76.9%. Duration of therapy was from 3 weeks to 6 months, but actually if you look at the literature, up to 2 years of a non-stop shows no toxicity. We had a long-term near complete remission of rheumatoid arthritis in 60% and partial remission in 30%. The COPD, the patients with chronic pulmonary disease had increased efficacy in 86%, increase of the monocyte phagocytic activity 78%, and the products are very well tolerated, less than 2% side effects. There were absolutely no septic complication in patients who used thymus regeneration therapy and went for chemo and radiotherapy. Not a single case, and not a single case of neutropenia in those patients. Not a single case of neutropenia. So we have, of course, done the immunology tests, immunogram. We have seen the actual statistically significant increase of the naive forms of the thymocytes, increase suppressor cells, which is very important because of the autoimmune component adding on, and reduction of the CEA levels in the cancer patients who are undergoing this treatment. Now, talking about the brain, you know, we mentioned the pleiotropic effect, and I'm almost done here. It turns out that addition of the thymus peptides to the overall anti-aging treatment protocols increases the number of insulin receptors in the central nervous system, which with a modern understanding of the dementia and Alzheimer's, which is actually is the diabetes type 3, we have managed to upregulate the insulin receptors in the central nervous system. Please see that is published. And of course, it is widely used in anti-aging and rejuvenation because you cannot reduce your biological age when your thymus is continuously aging. Yeah, so obviously. Adverse reactions, very rare. If you look at the publications, actually there's only 2 cases of toxicity were developed, toxicity on the thymic therapy ever described in the history of medicine, and 2 cases out of hundreds, tens or hundreds of thousands of patients who've used this. It shows pretty well tolerance. So once again, more you can find in reading these books. You can visit our websites or just the websites over here. You can see all the testimonials from the patients who use different therapies with the stem cells and all, and just drop by our booth, and please remember that neither you nor your patients, if you are a doctor, nor your relatives have to deteriorate as you age, especially if you can regenerate your thymus. Thank you very much. If you have any questions, drop by the booth and I'll be more than happy to answer all your questions.